Welcome to DocTalk with your host, Brent Leavitt. And DocTalk with Brent is sponsored by Battleborn Financial.
All right, welcome back to DocTalk. This is Brent Leavitt, owner and proprietor of Battleborn Financial Advisor and health insurance broker here in Pahrump and also in Las Vegas. We just opened a brand new office in North Las Vegas at 3365 West Craig Road, and we're helping serve people in all walks of life in Vegas and in Pahrump. We're joined, this show is gearing around Southern Nevada primary care. We love to talk about all the new things happening as a senior doctor. At my office, we handle health insurance and people's needs, but we found that health insurance and healthcare begins at your primary care doctor's office. It starts with taking care of yourself and your needs, and I want to make sure that you know the doctors so we can match you up with the right health plan to get you to see those doctors and make sure that you're getting the healthcare that you need and you deserve. We are joined by a brand spanking new health or medical provider here in Southern Nevada. They're taking storm and they're building out facilities all across right now in Southern Nevada, in Las Vegas, Henderson, North Las Vegas, and we're hoping to get them in Pahrump here pretty soon as well. But for now, in the time being, they have about 6 locations already planned to be built out beginning of this year or by the end of this year, and then beginning of next year, they even have 2 already slated to open up as well. It is phenomenal. They're wonderful. We're joined by Dr. Laura Addis. She's been practicing here in this town for about, I think you said 16 years. Is that right? 18. I'm even off on the number. And they're brought to us by Partners in Primary Care. So that's a name you're going to remember. Partners in Primary Care. They focus on helping the Medicare population, people strictly that are over 65, and also on Medicare Advantage plans. They service that population only. They are wonderful partners, specifically with Humana. That's the main one that they work with in Humana. They're a national company. They also work with other carriers such as Aetna at this time. I want to talk a little about Humana a little bit. We can't talk about specific benefits on this show or anything like that, but I want to talk about how they really partner with Humana. Partners in Primary Care, they're not just in Nevada. They're all over the nation, and they're growing and growing and growing. They're very aggressive, and their process for picking primary care doctors is very rigorous. They want to make sure that they get the best that they can get and talk to you and make sure that you're taken care of as a patient. That relationship with Humana is designed to make sure that if you're on a Humana Advantage plan, specifically like the Gold Plus or the Value Plus plan, you can see your primary care doctor at very little cost. A lot of times it's even zero on some plans. And you can see that primary care doctor and be able to get those referrals and that care you need. They've even have an expanded specialist network, which even covers Pahrump and Las Vegas and stuff like that. So if you want to see your primary care doctor, Partners in Primary Care, if you live in Pahrump, you can see a doctor there, and then you can even see your specialist in the Valley as well in Pahrump, as well as Las Vegas. Partners in Primary Care, they're a great facility. So with that being said, Dr. Addis, I apologize, I didn't really say much to you, trying to introduce you guys and everything. So tell us about you, your practice, Partners in Primary Care, who they are. Give us a little example about what's going on.
All right, well, thank you. Partners in Primary Care, as you mentioned, is new here in Las Vegas, and we are opening 6 clinics. Our clinic here in Spring Valley is opening next week. And then we are going to be 1 week after opening the clinic on Fremont. And the week after that, we'll be opening a clinic, I believe, on South Nellis. We also have a clinic that's going to be on North Rainbow, South Rainbow, and we'll also be having one on West Craig in the not too distant future, and also Henderson in the not too distant future. But what's really exciting about this is the clinics are brand new, and I'm actually sitting in one of the exam rooms in the clinic. We haven't even used it yet for a patient, but the clinics are bright and modern and airy and clean and beautiful, and we are totally focused about seniors. And what's unique about Partners in Primary Care is the way we approach our senior population, because obviously people who are seniors have different needs than people who are in their 20s, 30s, or 40s. One perfect example is in our exam rooms, we have chairs rather than exam tables, and they are nice, wide, comfortable chairs. They allow us to have the patient just walk in, sit down, and they don't have to climb up on a table, turn around, position. That's one of the things we offer. We also have a very unique approach in our way of caring for our patients. We work as a team, and in each center, we have a physician-led team, and on our team is our behavioral health specialist. We have a pharmacist. We have a social worker who really helps us with a lot of particular needs of seniors. We also have our medical assistants and center administrator. And it's the difference in working as a team, how we can be a partner in good health with our patients. Patients can come right to our clinic and have everything that they need addressed right in one location.
And can they get information online? Do they have a phone number they can call right now if they want to get information or maybe start scheduling appointments in the near future?
Yeah, actually, I can give you the phone number for our office, and they can channel you through to the proper clinic if there's a different location that may suit your needs. We're actually throughout the Vegas Valley, so there will be 6 clinics almost at every pivotal point in the city. But our number at this office is area code 725, which is different, 725-224-6967.
So remember that.
702 because you're not going to get us.
Yeah, a lot of people, we forget that they added another area code to our system because all the 702 numbers were already filled up, and now it's all 725 numbers. So
yeah, our city has grown so quickly that we really need to have more numbers.
Yeah, that's awesome. And then, of course, you want to schedule an appointment with them, get to know them, your primary care doctors. And I'm going to mention too, if you're on Humana already, you can actually change your panel to their facility. And all you have to do is change your primary care doctor by calling Humana if you want to have them as your primary. Same with Aetna as well. If you're on their premier plan, you can change over to them. They already have contracts set up, ready to go. I know it's going to affect when you change your plan to them, though, just so you know that the specialist network is a little bit different. So when you go to Partners in Primary Care, you change your panel to them, your specialist network is going to be a little bit different. It's actually going to be tied to Partners in Primary Care. So just so you know, like, make sure that we have them in our network, things like that. Talk to your broker, talk to your agent. If you have other questions, call my office. I mean, we have the office in North Las Vegas, off of Craig Road, the one in Pahrump. You can call the main number, see us both places, the 775-764-2252. We have a Vegas number, which is a 702 number, 702-582-7368. We can help you make sure you know and regulate that plan. So your health insurance can make sure you can see these physicians and get these new exam rooms and be able to get in to see them. Especially in this time of open enrollment coming up here in October to December, make sure that you get the right plan, get the right doctors. These guys are phenomenal. I mean, just the talking to them, getting to know them, the way they do things, they just really are passionate about medical care. I think you're talking to Dr. Addis. You've been in this town for 18 years. You've worked in different practices. You said you got to see Vegas at some clinics, and you found that your passion is in dealing with seniors. Is that correct? In there?
Yeah, actually, I came here from New York 18 years ago, so I still have my New York accent. When I came out here, I'm board certified in internal medicine. And when I did come out here, I did my training, my residency training at UMC right over here at the University of Nevada School of Medicine. And it was a great opportunity because I got to learn a lot of pathology and I got to learn a lot about how Las Vegas runs. Now that I've been here 18 years, I've gotten a very good handle on who the good players in town are in terms of specialists. I know the best cardiologists, I know the best hematologists, the best gastroenterologists. And what was so wonderful, touching on what you mentioned before, you were mentioning the specialist network. I had asked Dr. Wakefield, who's our medical director, a few weeks ago for a list of who is contracted to work with us here in the Valley. And I was totally surprised. They were all of the great specialists that I've been using for years. So what's wonderful is a lot of patients when they switch to a different insurance, they're worried, am I going to still be able to see Dr. Jones? Am I still going to be able to see Dr. Smith? Yes, more likely than not, you can, because all of these docs have contracted with Humana. So we have a great network. It's not a closed network that you see with a lot of these HMO organizations. We actually can send you to the best doctors here in the city. And of course, you'll have the best doctors taking care of you right in your primary care office.
Yeah.
But we're passionate about taking care of seniors. And that's going back to your question. I realized probably early on that I enjoyed spending time and taking care of my seniors more. And anybody who's been a patient of mine for 15 plus years probably will agree. I like to spend time with my patients. I like to learn everything about you. And that's what we are doing at Partners in Primary Care. We're not just here to give you a pill and get you out the door. We need to know everything about you, your lifestyle, what makes you get up in the morning, what motivates you, how can we partner with you to help you keep enjoying things in life you enjoy. If you're a person who likes to knit, how do we help you keep your hands strong? How do we keep you exercising? How do we keep you motivated? And most importantly, especially with seniors, how do we keep you engaged in life? And that's really important because a lot of seniors become isolated. And I love to see my seniors come in and talk to them about their grandchildren, their dog, their whatever it is they want to talk about. And they love that. And I love that. I love having that continuity of care with them. It's just something that's kind of special for me.
And Partners in Primary Care is nice.
Excited.
Yeah, and Partners in Primary Care, they allow you guys to do that too. I mean, they don't shackle you, and they're not the big, everybody thinks big corporate office, they're going to tell me to get in and out like a herd of sheep and just kind of get you in and out of the appointment. It sounds like Partners in Primary Care really focus on making sure you have time to meet with your patients too. They're giving you a little bit leeway as well. It's
why I chose to join the company. You know, we're allowed a lot of time to spend with our patients. I don't have to be in and out of the room in 5 minutes. And it's really important to spend time with people, especially somebody who is older. We have more needs as we get older. Our medical histories are a lot more complex. There are more social stressors, especially now with COVID. A lot of people are afraid to even venture into a doctor's office. We have telehealth.
Yep.
So we can see you either we can talk to you on the phone and have a visit that way. We can meet on a Zoom meeting like we're doing here, or FaceTime, or any media way that you're comfortable with. So we want to keep our people healthy, and if it means keeping them engaged, even from their own home, we're prepared to do that.
And we're going to go to break here in a second, but when you get back to the break, I want you guys to tune in. We're going to take a little tour of the facility as well in our next session, and then she's going to kind of show us a little bit of the exam room, things like that, and show us what's going on, and we're going to really enjoy that. So please come back, stay tuned, and enjoy the commercials, and come back and see us. Thank you.
Welcome to DocTalk with your host, Brent Leavitt. And DocTalk with Brent is sponsored by Battleborn Financial.
All right, welcome back to DocTalk. Love to have you here. Just to reiterate what we're doing here today, we're Battleborn Financial. We're here in Pahrump, and we also have office in Las Vegas, helping people with their health insurance needs. We're interviewing primary care doctor in the Southern Nevada area. We have a wonderful, brand new primary care doctor group called Partners in Primary Care joining us today. We have Dr. Laura Addis, who is willing to come out and talk to us, and she's going to give us a quick, view of what Partners in Primary Care is. And this is I'm kind of excited for this, to kind of see the new activity rooms, the exam rooms, what it's going to be like to be here, a part of this whole group. Right now, she's in their South Decatur location, which is in the Spring Valley area. So if you live in that area or want to travel there to see Dr. Addis, she's going to be at this clinic. They're opening like in the next week, so they're going to start seeing patients. Make sure you go and call. Their website is partnersinprimarycare.com. Register to see them. If you're already a Humana member, or even with the Aetna Premier Plan, you can see them and make them your primary care doctor. I want to reiterate too, just so you know, when you change your primary care doctor, especially with Humana, it will change a little bit of how your specialists go, because Partners in Primary Care have a specific list of specialists that they work with. And they want to make sure you're seeing some of the best doctors, and that specialist network is a little different. So if you're on Humana Gold Plus and you're with the other plan right now, the other doctors, if you want to change to this doctor, it will change a little bit of how your plan works. If you're looking to change plans or come new to the plan here this year, we highly recommend it. This is great doctors. You can call my office if you have questions about how it works. You can talk to us, and getting on the Humana plan or Aetna Premier plan, whatever you want, to be able to see Dr. Addis and the Partners in Primary Care doctors. Our phone number is the same in Vegas and Pahrump, 775-764-2252. You can schedule us online as well at battlebornins.com. You can schedule an appointment to talk to us, a health insurance broker, about your health insurance needs. We have wonderful agents to work with you. We got Aubriana, we got Jindy, we got Shelly, and we got Brent. They're wonderful agents that'll help you out in what your needs are. With that being said, we're going to kind of turn the time to Dr. Addis again. I've taken away from her a little bit, and she's going to give us a little, she wants to show us a little bit about what they're going to be doing in Partners in Primary Care, how it looks. So go ahead and kind of give us the tour a little bit.
I'm in our activity room. I had mentioned that Partners in Primary Care is different in a lot of ways. One of the things that we have that's really cool is our Patient Activity Center. And pre-COVID or post-COVID, we're going to be able to utilize this a lot. Right now, we are engaging our seniors with virtual events. And I will give you that website at the end of our talk, but you can look at a real virtual visit. But this is our activity center, and we have television screens, and we will do exercise programs for our seniors in here. We'll have bingo. We'll have all kinds of patient engagement experiences. So it's a real big room, and it's a lot of cool things. I'd like to also give you an unofficial tour of the clinic, so we won't tell everybody about this.
You guys are getting exclusive here at DocTalk here.
I'm
So
sorry?
they're getting an exclusive here at DocTalk, things that you're not going to see normally.
This is not official. This is our front desk. Our lights are off right now, but we'll get them on shortly. We're still doing some construction. We're getting ready for opening on Monday. And some of our team members are already sitting here just getting ready for all of us to go live. And we walk down the hall, and we have our patient care rooms down this way. This is our care team room. This is where we all work together as a team. There's no private offices here. We all are in this. And here we have all of our people, our teammates. And this is where we all start taking care of our people. And then I'll show you one of our exam rooms. I'll go back to where we started because our exam rooms are really cool.
Yeah, this is the part we're most excited about because, you know, not only do they get to see what it's going to be like, and you walk in the door, you see that wonderful staff, they're all smiling, well, you can't really see their smiles because they're wearing masks, waving at you, telling you, welcome you in. And that care team is wonderful because they're making sure you're taken care of and also making sure they're coordinating all your care across all the lines with regards to your, not just your primary care, but your specialty and everything else too in that one place. And
absolutely.
Yeah, so let's see this wonderful chair that you talked about too. I'm kind of excited to see that.
Yeah, this chair is really cool. Let me just get back on
Put it down a
here.
little bit more.
So this is our exam chair. I'm sorry I keep losing my video here.
Go ahead and point it down just a little bit more. We can see a little better.
Okay, so the thing that's, can you get this angle? Here we go. So this is the patient exam chair, and I'm trying to get the floor. What's interesting though about this is you could just sit on it like a normal person, and you don't have to climb on anything. What we also have in our exam rooms, technical difficulties. We have this screen here, and it allows us to plug in our computer so you can actually review, I can review x-rays and labs with you, and you can see it right on our screen. While you're sitting here, you can watch what I'm showing you on there. And then we also have what you see in any typical little room. But we have this fabulous artwork also all throughout the clinic, beautiful photography that was actually all done here in Las Vegas. So this was our little unofficial tour. We actually have a much better virtual tour that we can give you. And it is at seniorfocusedlasvegas.com.
We'll put that up here on the screen here, but seniorfocusedlasvegas.com.
Lasvegas.com. And on that, you will be able to see our mobile discovery experience, which is the virtual tour of our clinics. And you don't even have to come in here, and just stay home and relax in the comfort of your home and see what we're doing.
And we're going to talk about COVID safety, because I know a lot of people right now, they're putting off seeing primary care doctors. And I'm going to tell the audience a little bit of personal experience we're having in my own family too. My father just turned 65. He joined the Humana plan as well, whatever HMO plan, and getting to see a primary care doctor, it's been interesting, because they put out, my parents, they're getting older, but they think about, our bodies, we're so used to being young and healthy, and we think everything's great and whatever it is. And we're finding with my mom and my dad, they're a little older, it's like, wait a minute, their health isn't as good as they thought it was. They're seeing their doctor, they're finally getting in. I'm like, Mom, Dad, you guys, we're in this industry, you need to start seeing doctors and getting in to see them. And I've even done it myself. The more interviews I do, I'm starting to see my primary care more just to make sure I'm getting better, take care of my health. See your primary care doctor and get to know where you're at. Because, they're finding things like my father had some heart conditions. It's like, well, wait a minute, you didn't realize you had heart conditions. As you get older, your heart doesn't beat like it used to, or your body doesn't act like it used to. You might even things like just little things like on your skin, little marks you get on your skins and things like that. That's the great thing about internal medicine doctors too. You look at the whole picture of what's going on internally, and you can help them find things like, wait a minute, maybe you have little scars there, or maybe there's something happening in the digestive tract that needs to be worked on, and you'll get the referrals where you need to go. So don't be afraid to see your primary care doctor. And you'll find that your health insurance policies, I don't care even if you had a copay for primary care, like on the Humana PPOs, things like that, you're going to have a zero cost to see them for your preventative visits, to see your doctor. Getting those things like your flu shots and vaccines are wonderful and worth the time to get them. I know, Dr. Addis, you want to talk a little bit about COVID safety, and that's a big concern for a lot of people, especially right now. The year of the COVID is just making sure that we're safe going to see the doctor, and a lot of people are a little bit concerned or worried about that. So what do we want to talk about with that? How does that affect you guys?
Well, actually, we're really taking very strong strides to ensure cleanliness. We're deep cleaning our clinics regularly. But as far as patient contact, as I mentioned earlier, we do have telehealth visits, telemedicine, so we can see you virtually, either on the phone, FaceTime, Zoom, whichever you're comfortable with. We can see you on whatever media platform you're comfortable with. But if you come into our office, we're ready. Everybody who enters our building, every single person who enters the building has to have their temperature checked, and they are screened for questions. Have you been sick lately? Have you had a cold? Have you had a fever? The usual questions. And we are getting patients out of the waiting room quickly into exam rooms, so they're private. And if we do have somebody that is COVID positive, or we suspect that is, and we need to see them, we're going to be doing a couple of different options where I know some of the clinics in Houston that I visited recently with Partners in Primary Care, they were actually doing visits in the parking lot, and they had screen partitions to ensure privacy for the patients, so nobody was looking at what they were doing. And we actually have a back parking lot here that we might be able to utilize for that purpose. But we also have exam rooms that are dedicated to people that are sick, so they don't have to cross through the clinic. They're not crossing other people. They can come right in the back door and go right out the back door. So we're doing as much as we can, and even more so, even more than I've told you about, but that's the things that people actually see.
Yeah. So, if you're a very safe environment. If you're sick, they'll make sure you're taken care of. Even if you really need to see a doctor, get the care you need. Make sure you're not worried about, am I going to go to the hospital? Am I going to be sick? Really, the purpose of primary care is they don't necessarily want to see you in the hospital. They want to make sure you're taken care of, getting the care you need now and in a safe environment. Make sure you're checking them out. They're going to be doing open houses throughout the time. Keep track of those. I know they've moved a couple of them on us. This is going to air. This is airing either Thursday and Saturday. If you're watching this week, Monday is going to be, or Tuesday, I think we're looking at doing an open house at your clinic on South Decatur. So look out for those clinics. Come out and check them out virtually. Can you give us that website again for the virtual tours?
It is seniorfocusedlasvegas.com.
Seniorfocusedlasvegas.com. So they're focusing on Medicare and patients in the Valley, and they're coming into the vengeance. They want to be here. They want to be the big player in town. make sure that you're being taken care of. They're not just coming in a small little clinic here and there. They want to come out and give you guys, everybody in the area, just an example and ability to see patients in a good manner. Dr. Addis, thank you so much for being with us today on DocTalk. We're going to be closing out the session here today. Just a reminder that if you guys have any problems with healthcare needs, see Partners in Primary Care and talk to our office at Battleborn Financial. We're here to help you manage your health insurance needs to make sure they match with your primary care doctors. We look at everything with regards to your health insurance, your doctors, and your medicines. We want to make sure everything's coordinating correctly, so that way when you go see the doctor, you're not worried about, is my insurance going to pay? Can I afford it? We want to make sure everything's in line with you. So thank you for checking us out. Go online, check out our website, call the office, and we'll see you again here next week. Thank you.